Dr. Ashley Winter. I'm a board certified urologist. And if you don't know yet, I'm the Chief Medical Officer at Odella Health. Odella Health, what do we do? So we are a online clinic. We do virtual sexual medicine consultations, 100% free. We also offer sex and relationship coaching with certified sex therapists, and we collaborate with physical therapists across the country. In all the states we're active: New York, California, Florida, Colorado, Michigan, Illinois, Pennsylvania, and I think also Virginia. But yeah, and our goal is to, have accessible, evidence-based sexual health care for patients around the country, and work with our whole team. And I am so excited to introduce to you two very special people to me. The first is Dr. Josh Gonzalez. He is also a board certified urologist, and he preceded me 2 years in doing the only fellowship in both men and women's sexual health with Dr. Irwin Goldstein in San Diego. And he is a TikTok famous, espousing excellent evidence-based sexual health information on TikTok, and doing excellent moves while he's at it. And then our friend Stephanie Prendergast, who is the co-founder of PHRC, which is a absolutely phenomenal big pelvic floor physical therapy practice. They have multiple locations throughout California and also in New England. And and so today they're going to talk about how urology and pelvic floor therapists can work together. And also just, they're both entrepreneurs, and, talk a little bit about how they got into their practices and their involvement in social media. And yeah, so I will let you guys take it away.
Well, thank you. Yes, thank you. And thank Odella for hosting these events, and for the physical therapists that are watching. I mean, I think everyone can see that Odella's been making a significant move to help us have a seat at a table, really, and to help acknowledge the work that pelvic floor PTs are doing. So we want to thank you for having us both as well. And Dr. Gonzalez, let's start with you. What made you interested in sexual medicine?
That's a good question. So let me back up a little bit. I'm a urologist by training. And when I was in my residency, which I did in New York City, we get exposure to a lot of different fields within urology. And I was kind of initially drawn to men's health. So when it came time to think about applying for fellowships, I applied to a lot of the different men's health fellowships across the country. One of the fellowships that included men's health was Irwin's fellowship down in San Diego. I went to meet with him, and he said, you have to be willing and interested and excited to do female sexual health if you want to do this fellowship. And as a urologist, I mean, Ashley can attest to this, we don't really get exposure to anything female sexual health. In fact, I think in medicine in general, we do a pretty crappy job of addressing that in any of the medical fields, but generally that seems to kind of fall into the gynecology world. And so we really had very little exposure, at least in my program. But I spent a few days with Irwin. I thought it was very, very exciting that I would be able to, if I did the fellowship, offer care to both men and women who had sexual health issues. And so I was fortunate enough to match there. I spent a year with Irwin. And really, I mean, spending that year there was what made me more interested in the sexual health space, because we had so little exposure to it in residency. I just knew that I hated everything else in urology and didn't do that, and was mostly drawn to men's health, but I didn't really know that I had a passion for it until I actually started doing the work. So it was kind of a long road to get there, but I am thrilled that this is the career that I've chosen for myself. And I've met a lot of incredible people like Steph and Ashley along the way. And it's, I think, a really special field in medicine because it's so collaborative, and you need to know a lot of different kinds of people and a lot of different kinds of practitioners to help patients with sexual health issues. So yeah.
So, and to interject here, I did the same fellowship that you did. And one of the absolutely essential things that I took away from that was that, Dr. Goldstein there had a pelvic floor physical therapist in his office. And I learned how important that was, both in diagnosis and treatment of so many really common concerns. So, coming out of that fellowship, when I was jumping into practice, I was immediately like, okay, I need to get to know these physical therapists like in my community and make that relationship. So I'd love to kind of, find a little bit more, about how you, Josh and Stephanie, how you guys kind of hooked up and started working together.
We actually
not like
met
hooked up, but like hooked up
No, yeah.
professionally. Just so everybody knows that.
So Steph and I actually met when I was a fellow. And I was the same in the same boat as you, Ashley. Like it's incredible to me that we did, full urology residencies, never being told how important pelvic floor physical therapy is for everything that we do. And so I didn't really come to learn that also until I was a fellow as well. And then, I think the stars aligned and brought Stephanie to San Diego. I think you were there. Steph, how long were you there? A couple of days or something. We met and kind of hit it off.
Yes, we did. And I know you said hooking up. We didn't. But when I saw Josh in the OR, I was like, oh, who's that handsome fellow? Because I had called off a relationship and moved to Los Angeles. And then all of a sudden, here's this person in the OR. So needless to say, he was not interested in me. And we're each gone our separate ways with our partners. But I came down to San Diego after moving to Los Angeles because I needed to get to know this community. I had been in San Francisco for the majority of my career. Similar to medical school, there's no training for pelvic floor in most physical therapy programs. So I had no idea that this was even something I could do as a physical therapist until I went to work for a urologist in 2001 by answering an ad in Craigslist, because this was like
no way.
Or I'm sorry, the San Francisco Chronicle, because it was even before Craigslist. No,
wow.
And then I was in an interdisciplinary practice that was focused on pelvic pain. And I know now how unusual and how lucky I was to have had that experience. That is no one's story, where they're working with an interventional pain doc, a urologist, a psychologist, and we're seeing nothing but women and men with pelvic pain all the time, all day. So there was a very steep learning curve, which also brought in the collaborative aspect of how we practice and how it needs to be with some of the higher level patients that need both medical management and PT. And so my background was a little unusual, but then I think that's how we also have collaborated through the years with practices in different locations and really putting a priority on local providers. I was in LA for a year before Josh got here, and we didn't have somebody offering your services. And so it was really exciting when you did decide to come to Los Angeles. And that's when we started really working together, is when you started in the Valley.
Mm-hmm.
Almost 10 years ago now.
I know.
Oh my God, you guys are making me
Don't
feel
remind me.
old.
Well,
oh my God.
she's talking about me. I'm the one that's been in practice almost 10 years.
2 years after you. So that's like, I finished fellowship a long time ago. Anyway.
I just said 2001 in the San Francisco Chronicle.
Before Craigslist. Before Craigslist.
I don't believe that. Craigslist must have been around then.
That's the real BC.
I didn't know how to use it because I had AOL and I plugged it into a wall. So
oh my God.
I didn't know how to use it if it existed.
All right. Okay. Well, I would say, a lot of us, this is the question for you, Stephanie. A lot of us think of like physical therapy as a service that doctors will send a patient to. But I have found that there's so much need for your services that oftentimes patients are finding you guys. And I'd love to hear, kind of your thoughts on typical, patients you see, but also patients that you see and you end up referring, to a urologist, gynecologist, urogynecologist, and kind of, when that relationship is most successful. And, some of the patients you've shared with Josh, obviously, no HIPAA, but whatever. So yeah.
No, of course. I mean, I think over time, and we all are in this situation, anybody who has an interest in helping the umbrella of pelvic health is patients can enter our office at any point during their treatment plan. They may have found us on Instagram or TikTok. They may be referred by a doctor who said, maybe go to physical therapy. It may or may not help you. That's not how I want the world to go. It's very different if a physician says, pelvic floor physical therapy is going to help you. I'm sure you didn't think about this for the type of irritated bladder symptoms and intimacy issues that you're having. So the messaging is important, but they also may have been said, PT may help you. They're thinking about physical therapy for an ankle or knee. Why on earth would they think about me if it hurts when they have sex? They can't sit down and they feel like they have a UTI. They're not going to. But a quick Google search is leading people down a social media path. So we just need to be prepared at any given moment for what the person is coming in with. And is this a physical therapy thing or not? And I think that's one of the most important things, people getting started, people already working. We always have to keep an eye on kind of the umbrella of things. And sometimes that's out of our scope of practice. And so we really need to be versed with these various relationships about what we can and can't do. And I think one of the things that overlaps, one of the closest, is some of the hormone deficiencies that can occur at various points in someone's life. And it can look like an infection, a pelvic floor disorder, or a urologic condition. It never looks like a hormone deficiency to most people unless they're fully in menopause, but even then they may not understand the genitourinary syndrome of it. So as far as we go, I think it's important that we know what's somatic and what isn't, and then really making those connections with people in all the different locations to help whatever it is the patient may need.
Yeah, I think one of the things that was helpful in fostering the relationship that I have with Stephanie and her associates was, this was a long time ago, Steph, but like at some point after I was in practice, I did a kind of in-service with Stephanie and her colleagues. And we literally, I gave a presentation, we went over the anatomy, I went through symptoms that patients will describe when they come in that could be indicative of a hormone problem. We went over signs on the physical exam and specific areas to examine, when you're doing your physical therapy evaluation. And I can't tell you like how many times over the years Stephanie has, or her colleagues have sent me patients who come in for frequency urgency, and they do their evaluation and notice that in fact that person has vestibulodynia and probably would have never said anything, but now they're asking the question, well, when you have sex, do you have pain? Okay. And then when they elicit that information, then refer those people to me to rule out a potential hormonal, contribution to their problem. So I think partnering with a specialist in your area, medical specialists, and doing an in-service with them can be extremely valuable, because we did it one time and it's been years since then. And Stephanie's taught her colleagues to look for the same things. And so I feel very confident when they send patients to me that this is someone that probably does have a hormonal issue, and we can help them.
And that's why I want to encourage people getting started too, to also look to the various lectures and things maybe outside of physical therapy. We need our physical therapy skills, but also if there isn't access to somebody yet, like the skills that you both are trained in with your fellowships, you can find it now on social media and start to educate yourself and look at the various educational webinars and things on YouTube without even going to the conferences. And that's been a huge change in the last 3 years, because hearing it from you and the physicians is different than hearing it from me. Both for patients and employees.
No, and Stacey, you had a great point about patients really perceiving what pelvic floor physical therapy is like, as when they think of going to PT for an ankle or something, like they're going to go to some place and like walk on a treadmill, and they don't really understand how that connects to their UTI symptoms. And that's why, and if there's anybody on this who's a nurse practitioner, a physician assistant, a physician, any sort of healthcare provider, I would definitely encourage you and you treat these conditions to get to know a pelvic floor PT in your community, or even like go to courses aimed for pelvic floor PT so you can understand what they do, because then you can explain it to your patients and have so much higher success in getting them to actually follow through. Because if you don't understand what they do, you won't be able to convince patients to go. And, like that was really huge, in me having success, sending people and having them success with their treatment of their symptoms. So
And
yeah.
after we started to work together, I mean, it took how long before we started sharing successes? I mean, probably, the course of time that people have to undergo some of these treatments can be, as we know, whether it's hormonal physical therapy, 3 months, 6 months, a year sometimes, before it's really, they're okay. They are done. They are happy. They are doing what they want to do. And so it takes a long time to build that trust. I also think, I mean, and as we're, new providers are meeting each other, just trying to figure out where we stand with how are we educating patients the same way? How are we collaborating? What's a disagreement? What do we agree to disagree about? And moving forward, I think it's so important. And that did take a while.
Yeah. No, I think also, I mean, we lovingly refer to our pelvic village in Los Angeles, and that's something that's built over years. I mean, Stephanie and I, have been working together since 2015 when I started practice, but over the years we've found gynecologists who we need to refer patients who we suspect might have endometriosis, and understand the relationship between certain hormonal treatments that are used to treat that condition and how that can affect what we do. And we've worked with gastrointestinal specialists, we've worked with pain management doctors, and that is something, those relationships, that community, that village takes a long time to build. And I agree, it not only takes patients trusting those providers, but it also takes inter-provider trust. I know I don't ever have to question what, someone who Stephanie is referring to me is appropriate for me to be seeing. I never ever question that, but that's not something that that's something that gets built over time. And I feel fortunate that we have that community of providers in Los Angeles to help patients, because I think given the nature of what Steph and I do, we attract and often see pretty complicated cases, and it's not just a slam dunk here, here's some vaginal estrogen and boom, you're done. It's like, okay, yes, we're going to start with that, but you also need to see Stephanie, and you have GI symptoms, we're going to send you to this person. And it's these cases are complicated. And so I think taking the time to nourish those relationships with other providers is going to be really helpful for you as a practitioner, but also most valuable for your patients.
I think that's such a great point. Like, you see so often especially with sexual health and pelvic pain complaints, you see somebody say, oh, I came to 4 doctors and I didn't get answers. And really what you hope would be that, you see 4 doctors or 4 healthcare providers, and each one's adding layers of information, right? So maybe not everybody has the whole answer, but when they speak together and they're on the same page, and, and working with evidence-based medicine, that maybe everybody's giving part of the answer. And I think, when you're building that village, like you can offer that. Yeah.
And I think, Stephanie and I, sorry, I'll make this quick.
No.
But I think Steph and I have the kind of relationship where, it's not uncommon for us to speak 5-6 times in a week about a variety of patients. And patients really appreciate that, because a lot of times they'll go to 5-6 different providers and no one is communicating. And so they're coming in and they're like, did you speak to my PT? Well, no. But when they're meeting with Steph and I, they know that we're sharing information. We're collaborating offline, outside of the office, discussing these cases and really kind of coming up with comprehensive treatment plans. So how to get these people better.
And it really helps to have platforms like this where it's merged together, because I think for a long time, and at the beginning of my career, obviously my situation was different, because I was already working with physicians and became leadership at a mostly medical driven society. I think a lot of physical therapists feel intimidated to reach out to their medical colleagues at times. And it doesn't need to be. We're not bothering if we're trying to do something helpful. I literally ask newer people that are in our field, what time are you in the car in the morning? Also important for LA, because there could be a good opportunity of 30 minutes where instead of getting angry at a political podcast, I could be talking to a newer colleague and it helping to like merge.
I love that recommendation.
Yeah, I mean, because we really think about it, we're lucky in that we all kind of have similar views anyway in our pelvic village, but like really getting to know people can sometimes be intimidating. And I think since the presence of social media, like posts, direct messages, and just try to do it when you be in the car.
I love it. Let's see. Oh, someone's here from Melbourne Beach, Florida. Hello.
Hello.
Awesome. So yeah, I don't know. Does anybody have any questions about this topic? Otherwise, I think we could kind of jump on to our next topic. Unless you guys, Steph or Josh, if you guys have any other kind of comments about this.
I think we're really going about collaboration and how these symptoms overlap. And if people do have specific questions, we're happy to answer. And I think part of some of this was business related questions as well.
Yeah. So yes, going into business. So, okay. So to recap, get to know the providers in your community, find out when they commute to work. If you're in LA or somewhere else with long commutes, no, but seriously, and and then try to be, kind of versed and, with what the other person does, so you can enthusiastically refer them, and just be collaborative. I think that's the takeaway. But yeah, I think if you guys have any tips as entrepreneurs or, for those of us who just really are so impressed with your business acumen and the growth you guys have had, we'd love to kind of know more about how you started your businesses and what you think are like the biggest tips for people who are looking to grow their business, be entrepreneurs, or even just grow their social media presence. We'd love to know your tips and tricks on that.
You first.
Okay. Well, I mean, it's funny that you're asking me to go first, because I honestly have to say, like, I think Stephanie has been a pretty big inspiration for what I have done with my practice. So in 2015, when I started practice, I actually was working in Encino in the Valley, like in the LA area, and was employed by another urologist. No idea what I was doing when I started. I got to the practice and they didn't even have a website. And I had no patients on day one. So I really had to work hard to foster relationships with providers like Steph. And I used, as best I could, social media and the internet to build a sort of like online reputation, which included everything from like asking people who seemed to like what I was doing for them to leave me a Yelp review, working with a web designer to build a website for the practice that I was working in, and really did that like kind of all on my own. Worked at that practice for 2 years. I think exceeded my expectations and their expectations in terms of my productivity, and kind of was at this fork in the road where I could have continued working there and I would have been comfortable, or I could take the opportunity to try to build something of my own. And I decided at that time that if I didn't take that risk then, that I probably would become too comfortable and wouldn't ever do that. And I remember specifically thinking about Stephanie's practices because at that point, like she was just growing and growing and growing. And I was hearing all the time about these new offices that were opening. And I just thought it was incredible that this person I knew was like not only a wonderful physical therapist, but also this like boss, like and able to run these practices so well. And so I remember calling her and asking her like for advice. And I think she was one of the people that at the time, really encouraged me to do it and said, you're going to be fine and you're going to be successful. And nobody's doing what you're doing and you're going to be, don't worry about it. But it's scary. Like as a solo provider, we're a dying breed in medicine. And, when people come out of urology residency, they go to work for large hospital systems or large group practices. But no one is preparing you to go into solo private practice. It just doesn't happen anymore. So, it was a steep learning curve. I had no idea what I was doing. I had to learn about how to run a payroll and, hire people and do managerial and administrative stuff. But I really, over the years, have relied on Steph because she has been doing this really well for a long time. And so even though our practices don't do the same things, I think entrepreneurs can help other entrepreneurs be successful by giving them just good, sound business advice. And so that's aside from, Steph being my colleague and a good friend, she's also been a mentor throughout this process for me.
Oh my goodness. I was not expecting you to say any of that.
It's true. It is true.
Well, I'm glad I could help because you are helping so many of our patients and I can't do my job without you. So I think that part of what makes us look successful is going back to what I said earlier about the relationships I feel so grateful to have you and your services, your ear if I need it, with our patients, and then us hitting those successes together. The more we work together, it's really grown. I don't consider myself an entrepreneur, so these business interviews always make me a little uncomfortable, which is maybe why we should just go back to you and your TikTok.
No. How did you become an entrepreneur? We need to hear it. You are so important.
She's not. She's being modest. She's a legit boss.
No,
of many people. And also, by the way, even though I do have like a decent TikTok following, I got into social media because Stephanie was doing that. And so again, following the footsteps.
Now you owe me because you're way more popular than I am.
Well, okay, here's a question.
That's just because I dance.
I can't dance.
You can't dance. Come on. You guys should dance together. Okay, I want to ask, how do you guys feel like social media has grown your practice, if at all? And, is it just that, you're directly kind of monetizing the platforms, or are you actually bringing in patients from those platforms? And if so, how often do you think you're doing that?
I'm not monetizing on our social media. But I think what was very important for me was it's part of our brand. And we wrote a book in 2016 called Pelvic Pain Explained. But in order to get a publisher for the book, I had to go on social media. And this was in about 2011. And I did not know anything at that time. And while we were good PTs, Liz and I, because of especially our beginnings, we definitely did not know how to manage or navigate social media. Went through a number of companies before the pandemic where we actually started working with our current, which is called Nailed It Media, and they changed everything. I mean, they helped me with professional illustrations and graphics and just things I had no idea how to do. And so for me, what's important is when we hear ourselves repeating ourselves, we had a very popular blog, but nobody wants the blog anymore. They would rather have a post or a YouTube video, which really pushed me out of my comfort limits. And I definitely, throw things during those videos. So for all of the people watching them, thank you, because I hate it. Yes. But it made a difference, I think, with getting education, like evidence-based education out, because it really bothers me to see so much misinformation, even before that was a thing.
Yeah.
Yeah. I think for me, I started doing social media, I think as kind of I don't even know what I expected out of it. I think initially I did it because I was like, I want to get more patients in my door, right? Like I want to be busier. This will be a good way to do that. And there's definitely been some patients who have come through my door saying that they found me on TikTok or Instagram or something like that. but it's not a lot. Like, it's not
Mhm.
what I thought when I started this. I think what has come from my social media presence is a lot different than what I expected, in that I've somehow become this like thought leader in the sexual health space. And I
Mhm.
think people are so starved for accurate information. And what we try to do, and I work with the same social media company as Steph, but what we try to do with my platforms is present helpful, interesting, sometimes taboo topics that people probably won't ask their doctor because they're embarrassed, and try to present that information in a easily digestible, disarming kind of way. And maybe that involves me doing a dance while I'm talking about, things that can cause erectile dysfunction. But it's grabbing your attention and being a little bit silly, but giving you helpful information. And maybe what that does is then allow people to gather more information, or get the courage to talk to their doctor about it, because we get a lot of DMs asking for advice. And I often will just have to tell people, like, we can't offer medical advice on these kinds of platforms, but
Mhm.
you should talk to your doctor. Like, if you feel comfortable DMing a stranger on Instagram, you should really talk to your doctor about this, right? So I think it opens that door for people where they feel a little bit more comfortable talking about topics that are really, really sensitive.
No, I love it. And I agree with both of you. I became a lot more active on social media at the start of the pandemic. And because that was really an eye-opening moment for me to realize how much bad health information was on the internet, and how
Mhm.
bad actors or, self-proclaimed like health experts who have no background. And I realized that all these people who, practice evidence-based medicine and therapy, we all had like our head in the sand. We were so busy with our training and our practices that kind of people who didn't know anything were making all the noise on the internet, and we have to like join in that. But also, to Stephanie's point, there's kind of like a workplace efficiency to it, because if you can say, like, I have this kind of clearinghouse of all the information that's important to me, and you can access it there. Like, I know when I have a patient that comes to me through social media, they already know why they need vaginal estrogen, and I don't have to talk them into like, they know
Right.
everything. You know what I mean? And that's
Yeah.
and so there is like a value there, like directly to the practice, in a way that I didn't think I would have.
And I commend you for your Twitter presence and how well you can navigate that, because I just post and don't engage on that platform because there's
Yeah.
so much hate. And
There's so
Yeah.
much hate. You just
you
ignore
handle
all of
it
those
so
people.
well.
But you have to
Yeah.
mute all of them. You don't even block them, because they love it when you block them and they get off on
Right.
that. So the
Yes, and
trolls,
then
you mute
posted
them.
on
And
Instagram that they were blocked on your Twitter.
exactly. I hate those people. I don't know why they do that stuff. Anyway, let's see. We have some questions for you guys, unless there's so why don't we dive into some of these questions? So Laura wrote, pelvic PT here in rural Kansas. The one urology practice in my town offers pelvic rehab with an RN who does biofeedback. Any tips on how I can reach these providers, and explain how I can add to their services to improve patient outcomes without them feeling threatened that I would take away from their business? So maybe Steph, do you want to kind of talk about that?
I think that over the course of time, the providers that I've learned to work with are the ones who are also open to wanting to work with us. And that can happen because of a patient success story. If it was a primary care who went on a limb and sent them to physical therapy. But over the course of time, just trying to get someone to believe in our services that may not want to or isn't ready to hear or collaborate yet is not a good use of time. Be useful. Be as useful as you can. I don't recommend showing up to a doctor's appointment or any of the visits that are intended for the patient. But I do recommend having that patient say to the provider, oh, this person's helping me, would you be interested in speaking with them? And if the answer is no, I'm not going to push it. There are other people you can turn to, even in rural areas, and they may show up in unexpected ways. So try to be useful. And what's useful for a lot of the people that are probably even more overburdened than we are as physical therapists is having this patient that they're not sure how to physically help the rest of the way get better.
I was going to say also, that it just came to me when you were talking, Steph, was maybe it's not the urologist that you approach, because the reality is, and I've seen this, where we live and work, they're probably billing for what those services are, and they're not going to want to get rid of that. And even though they probably know, if they've met a pelvic floor physical therapist, that what you guys do is going to definitely help more, they don't want to lose that income. So maybe you approach the local, primary care providers in the area and say, hey, next time you see someone with frequency urgency, or you identify prolapse or incontinence, in addition to sending them to the urologist, here's the services that I can offer. And so that you kind of intercept them before they get to a specialist who's going to not ever really want to let go of them, right? They're going to want to get to be able to bill for as many services as possible. It's going to be a hard sell to try to say, instead of you being able to bill for this biofeedback, why don't you send them to me? That's going to be an uphill battle, I think. So if you can kind of intercept them and be another provider that they see along with the urologist, then that might be a better strategy.
I think primary care is such a good solution. I really do. I think that their job is to help people get to the right place, and the idea of pelvic floor physical therapy could be a new idea.
Totally. And like you're saying, I mean, primary care is well versed in the process of referring, and oftentimes subspecialists like urologists really don't refer a lot of people out. I mean, honestly, like when in my last practice, the only people I would really refer to were pelvic floor physical therapy. And if I wasn't so familiar with them, I probably wouldn't be referring to anybody. Who's like, just referrals come to me. So I think that's a great point. And just showing them all the common diagnoses that you guys manage, right? Chronic ball pain. Like, how many people come from the primary care doctor with chronic ball pain? Like, you can help with that. Like, just they'll be overjoyed that they don't have to have their patient on like the urologist waiting list. You know what I mean? So yeah. So here, let's see this next question from EP. As a patient, how does one build a multidisciplinary team where a urologist, physiotherapist, and psychologist will all communicate together to help an individual progress?
I was going to say, I think that's just depends on your community, but I would say one reasonable thing to consider would be going to an interdisciplinary like conference, right? So we, Ashley, Steph, and I are all part of an organization called ISWISH, which is geared specifically, it's geared specifically to women's sexual health. But the amazing thing about the organization is that it involves physical therapists, urologists, gynecologists, sex therapists, psychiatrists, all kinds of different providers that treat women's sexual health and all the various, ailments, issues that come up in that space. And so I think being proactive and seeking out conferences that involve multiple disciplines can be really helpful, and the networking that happens at those conferences can be incredible. And you find someone in your area, and then you stay in touch with them, and it just takes time to kind of build those teams.
And I think I'm so sorry, but it's a smaller society, so there may be face-to-face opportunity compared to going to some of the bigger societies that have like 20,000 people.
Yeah. I would also say, if you're approaching this as like the patient and you're desiring to have a multidisciplinary team, one, look out practices that have a multidisciplinary team, right? I don't know, try to find online reviews, or if you're working with a physical therapist, ask them what doctors they work with that are very collaborative. But then, also, if you're looking at this on a broader level, I would say search out people who identify as patient advocates and kind of get their advice on this, because those are really, I'm not schooled in being a patient advocate, but I see those people at conferences like ISWISH, and they say, I'm not coming to this conference as a medical provider, but as a patient who's had to navigate this complexity. And oftentimes they have amazing tips on, making sure providers speak to each other and, help you get productive care.
And as a patient too, please know that sometimes not all providers, it's not that they do not want to help. But for example, even when I reach out to some newer people who don't know me from anyone else in the community, I mean, sometimes they don't answer my emails, the texts as like a different provider that's also seeing a patient. I may have been too intimidating. They may not know how to talk to me either. Who knows? But I mean, just asking, would you be willing, but know that if they aren't necessarily a specialty level, because what we're talking about here is a different level of communication than gynecologist to urologist, who the gynecologist may be saying vulvodynia, the urologist may be saying IC. What if this is the same thing? They may not know that. And so also having, I think, compassion for the providers, which I know can sound hard to hear, they just may not know or have time. It doesn't mean that they're not trying though. And in a few months, that person may have a different story. So I think that the healthcare community is under a lot of pressure, and we just have to acknowledge that too.
Yes. But I don't have an adversarial,
and people can't
attitude towards other healthcare providers. We all want the patients to do well. And the people who, are making our lives worse are like health insurance companies and like evil things like that, not each other.
I was going to say, I think,
I always say, call your congressman.
It's not uncommon for me to see women with, various sexual health complaints who have seen 5 gynecologists. And a lot of times when I'm able to diagnose them appropriately and offer them treatment and they get better, they'll often express frustration, anger, and sometimes that's geared towards other providers. Why didn't my gynecologist, figure this out? Or, why have I? And I usually say to them, you have to keep in mind, they weren't trained in this. I wasn't trained in this. I did 5-year residency program and didn't know anything about this. I had to choose to do a fellowship in sexual health where I learned all of this. I learned about women's sexual health. I learned about pelvic floor physical therapists, but that's because I was interested in it and chose to learn this. We as, medical providers go through medical school and a number of years of residency training, and no one talks to us about sexual health. So, I don't blame those patients' gynecologists because they were just never taught this stuff. So it's about, us giving the patients this information, and then hopefully they share it with a friend of theirs who may be dealing with the same thing, and slowly kind of building that information, in the community. But I never blame other providers for not knowing, what's going on with somebody,
or not feeling comfortable to talk.
No, if I hadn't done our fellowship, Josh, I would have thought all pelvic pain was fixed with antibiotics. But that was the problem. I knew it wasn't, but I didn't
all
urologists
do, right? Chronic prostatitis, just give them antibiotics for 6 months, so they'll be fine.
Right. Or it was interstitial cystitis, right? And it's just and it doesn't mean I didn't want to fix the problems or help people. It was I just didn't have the tool. So I think that's such a helpful narrative to give patients, because it helps them say, you're right, I'm gonna do what I can to increase awareness about this.
They become the advocate, right? They become the person that then spreads the information.
Exactly. Great. Well, does anybody else have any questions? You can also take yourself off mute if it's easier than typing. But if not, I'm just going to say, I know it's, especially for the people on the East Coast, super late. So it was awesome having you all here. Thank you for joining. And it was great talking to you, Josh and Stephanie. And, I'll see you around. And certainly, if any of you have patients with sexual health concerns, Stephanie, Josh, and myself through Odella are all enthusiastically taking care of patients. So, just check us out. You're
Thank
welcome,
you,
Boston.
everyone.
Yeah.
All right, great. Well, everybody, anything else, anybody? No? All right, very good. Yeah, have a great night, everyone,
All
then.
right.
Thank you for joining
Thanks,
us.
everyone.
Yeah,
Good night. Thank you.
Night.
bye.